Most people believe that if a surgeon recommends an operation, it must be the right decision. The doctor knows best. The hospital is prepared. The procedure is routine, so you sign the form. But let me ask you something. What if the real danger is not the disease inside your body, but the operation meant to fix it? I've seen something most people never see. Not in headlines, not in brochures, not even in most consultations. I've seen patients walk into the operating room talking, smiling, hopeful, and come out alive, but never the same again. Not better, changed. A man in his 70s who came in with manageable heart symptoms and left unable to recognize his own daughter for weeks. A woman who survived what doctors called a successful surgery, but spent the next 6 months fighting complications no one warned her about. And here's the part that may surprise you the most. It wasn't the disease that nearly took their lives. It was the surgery itself. My name is Dr. Ethan Parker. I'm a cardiothoracic surgeon, and I've spent over 2 decades inside operating rooms, making life and death decisions every single day. And after all those years, there is one truth I wish every person over 60 understood before agreeing to any major procedure. After a certain age, your body does not respond to surgery the way it used to, not even close, because surgery is not just a fix. It is a controlled trauma. Your heart is stressed, your lungs struggle to recover from anesthesia, your kidneys slow down, and your brain, this is the one most people are never told about. Your brain can become disoriented in ways that last weeks, sometimes months. Doctors even have a name for it. But most patients hear about it too late. Now here's where it gets even more important. Age alone is not the problem. I have operated on 80-year-olds who recovered beautifully and 60-year-olds who never truly bounced back. The real issue is something far more dangerous and far more invisible. Frailty. A silent decline in your body's ability to recover. And once that threshold is crossed, everything changes. Because the question is no longer, can you survive the operation? The real question becomes, can your body survive what comes after? Today, I'm going to show you 5 common surgeries that carry serious hidden risks for people over 60. Not to scare you, but to give you something far more powerful than fear clarity. And if you stay with me until the end, I'm going to give you one question you can ask your surgeon that could completely change the course of your treatment and possibly your life. Okay, let's get into it. Surgery number 1 is open heart surgery in frail patients. Now, I want to be very clear from the beginning. This is one of the most powerful, life-saving procedures in modern medicine. When it's done on the right patient at the right time, it can restore blood flow, relieve symptoms, and add years to someone's life. But here's what most people are not told. Open heart surgery is not just a repair. It is one of the most physically demanding events the human body can go through, because during this procedure, your heart is actually stopped completely. And while surgeons work, your body is kept alive by a machine, a heart-lung bypass system that takes over the function of your heart and lungs. Now, for a relatively healthy 60-year-old, the body can often tolerate this level of stress, but after 70, especially in someone with underlying conditions like diabetes, kidney disease, or mild cognitive decline, this becomes a very different story. Here's what's really happening inside the body. That bypass machine doesn't just support circulation, it triggers a full-body inflammatory response. Your blood is circulating through artificial tubing. Your organs are temporarily deprived of their natural rhythm. Your immune system goes into overdrive. And in a younger, resilient body, that storm settles. In an older, frail body, it doesn't always. This is where we start to see serious complications: stroke, kidney failure, prolonged confusion, days or even weeks on a ventilator. And the numbers behind this are not small. Studies have shown that in frail elderly patients, Major complication rates after open heart surgery can reach 30 to 40%. Think about that for a moment. Nearly 1 in 3. And for high-risk patients, up to 15% do not survive the first 30 days after surgery. Not because the surgery failed technically, but because the body simply could not recover from what it went through. Now here's the part that changes everything. Many patients are still being presented with open heart surgery as the default option, without a full discussion of less invasive alternatives. Procedures that don't require opening the chest. Procedures that don't require stopping the heart. One of them is called TAVI, transcatheter aortic valve implantation. Instead of a large incision and bypass machine, a catheter is inserted through a blood vessel and guided to the heart. The valve is replaced while the heart is still beating. No full shutdown, no massive trauma. And for many older patients, especially those with frailty, the outcomes can be significantly safer. Now, I want to be absolutely clear. This does not mean you should refuse open heart surgery. What it means is this. You need to ask a better question. Not just, do I need surgery? But is there a less invasive option that is safer for my body right now? Because that one question can be the difference between a difficult recovery and a recovery your body can actually survive. Moving on to number 2, aggressive spinal surgery. Now, back pain is one of the most common complaints after the age of 60. In fact, if you ask almost anyone in their 70s about their back, they will have a story. Stiffness in the morning, pain when standing too long, that constant ache that never fully goes away. And more often, the solution being offered is surgery, spinal fusion, multi-level decompression, metal rods, screws, and hardware inserted along the spine. And on the surface, it sounds logical. If something hurts, fix it. If something is worn out, stabilize it. But here's where things become much more complicated, because not all back pain is a surgical problem. And in older adults, aggressive spinal surgery can sometimes create more problems than it solves. Let me explain what's actually happening inside the body. When a spinal fusion is performed, 2 or more vertebrae are permanently joined together. That segment of the spine becomes rigid. It no longer moves. Now that may relieve pressure in one area, but the rest of the spine has to compensate. The levels above and below that fusion start taking on more stress than they were designed for. Over time, they begin to wear down faster. This is something we call adjacent segment disease. And it's not rare. In fact, it's one of the most common reasons patients need additional surgeries after a fusion. But that's just one part of the problem, because the surgery itself carries significant risks, especially after 65. We're talking about complication rates exceeding 40% in some studies for complex spinal procedures in older adults, 40%. And these are not minor issues. Blood clots forming in the legs, serious infections that require more surgery, hardware failure where screws loosen or break, and recovery can be long and difficult. Weeks of limited mobility, months of rehabilitation, and sometimes no meaningful improvement in pain. Now here's the part that frustrates many surgeons, including myself. When you look at the long-term outcomes, for many elderly patients with degenerative back pain, aggressive spinal surgery does not provide better pain relief than non-surgical treatments, not better than physical therapy, not better than targeted injections, not better than structured movement programs, just riskier. So why does this keep happening? Because pain is powerful. When someone is suffering every day, the promise of a fix becomes incredibly appealing, and surgery feels definitive. It feels like action. But after 60, the question should never be just, can we operate? The question should be, will this actually improve my life enough to justify the risk? I remember a colleague of mine, a brilliant spine surgeon, once said something that stayed with me. Sometimes the best operation is the one you don't do. And that's not hesitation, that's wisdom. So if you've been told that surgery is your only option for back pain, I want you to pause. Ask one more question. What are my non-surgical options? And what do the outcomes actually look like for someone my age? Because in many cases, the safer path may lead to the same destination. Now let's move on to number 3, major cancer surgery. This is where the conversation becomes much more difficult and much more emotional. Because the moment someone hears the word cancer, everything changes. Fear takes over. Time feels limited. And the instinct is immediate. Cut it out. Remove it. Do whatever it takes. And I understand that completely. Any of us would feel the same way. But here's what 2 decades in surgery has taught me. And this is something not enough patients are told clearly enough. The goal of treatment is not just to remove the tumor. The goal is to give you more good years of life. And sometimes this is the uncomfortable truth. Major surgery in an older, frail patient does the opposite. Let me show you what I mean. There is a procedure called the Whipple surgery. It is one of the most complex operations in all of medicine, often used to treat pancreatic cancer. During this operation, we remove part of the pancreas, part of the small intestine, the gallbladder, and sections of the bile duct. It can take anywhere from 6 to 10 hours. In a younger, strong patient, it can be life-saving. But in an 80-year-old with heart disease, reduced kidney function, and decreased physiological reserve, the story can look very different. The surgery itself may be technically perfect. The tumor is removed successfully, and yet, the patient never truly recovers, not because of the cancer, but because the body cannot withstand the stress of what was done. This is something we call failure to rescue. A complication occurs, an infection, a leak, a cardiovascular event, and the body simply does not have the reserve to survive it. And the numbers here are sobering. Studies have shown that nearly 1 in 5 elderly patients undergoing major cancer surgery experience this outcome. 1 in 5. Now, I want to pause here because this is not about saying surgery is wrong. There are many cases where it is absolutely the right choice, but what's missing in many conversations is balance. Patients are often told what can be removed, but not always what might be lost. Strength, independence, clarity of mind, months of quality time. So here's the question that almost no one asks, but everyone should. If we don't operate, what happens next? What does watchful waiting look like? What about radiation, targeted therapy, symptom-focused care? Because in some cases, especially in older adults, these options can offer similar survival with far less physical cost, and more importantly, with better quality of life. This is not about choosing less care. It's about choosing the right care for your body, your goals, and your life. Because sometimes, the bravest decision is not to fight harder, but to choose a path your body can actually sustain. Now let's move on to number 4. Elective joint replacement, hip replacements, knee replacements. These are often described as some of the most successful surgeries in modern medicine. And in many cases, that's absolutely true. I've seen patients go from barely being able to walk across a room to playing with their grandchildren again, traveling, living independently. It can be life-changing. But here's where the conversation needs to become more precise, especially after the age of 75, because the word elective is doing a lot of hidden work here. Elective means this is not an emergency. It means you have time. Time to think, time to prepare, and most importantly, time to decide if this is the right moment for your body. Because while the surgery itself may be routine for the surgeon, your body is not routine. Especially if you're living with multiple health conditions, heart disease, diabetes, chronic kidney issues, reduced mobility. When 3 or more of these are present, The risk profile changes significantly. Now let me explain what's happening inside the body. After joint replacement, your body enters a state of recovery that requires strong circulation, stable heart function, and the ability to heal tissue efficiently. But in older adults with compromised systems, that recovery becomes much more fragile. One of the biggest risks is something called deep vein thrombosis, blood clots forming in the legs. And here's why that matters. If one of those clots breaks loose, it can travel to the lungs and cause a pulmonary embolism, a life-threatening event that can happen suddenly, even after what seemed like a successful surgery. And the risk of this is significantly higher in older patients with reduced mobility and slower circulation. But that's not the only concern. After surgery, many patients spend long periods lying still. That increases the risk of pneumonia. It weakens the muscles further, and it creates an environment where hospital-acquired infections can take hold more easily. So again, the question is not, is joint replacement a good surgery? Because it often is. The real question is my body fully prepared for this surgery right now? And this is where something incredibly important comes in, something most patients are never told about: prehabilitation. Preparing your body before the operation, improving your strength, stabilizing your blood sugar, optimizing your blood pressure, working on mobility and nutrition. Because when patients go into surgery stronger, they come out stronger. In fact, some hospitals now require prehabilitation programs for higher-risk elderly patients before they even schedule the procedure. And that approach makes a measurable difference. Fewer complications, shorter hospital stays, better long-term outcomes. So if you or someone you love is considering a hip or knee replacement, don't just ask about the surgery. Ask this: what can I do in the next 4 to 8 weeks to prepare my body for the best possible recovery? Because sometimes the success of the surgery depends less on what happens in the operating room and more on what you do before you ever get there. Now let's move on to number 5, emergency abdominal surgery. And this one is different from everything we've talked about so far, because you don't plan for it. You don't schedule it. You don't have time to think it through. It happens suddenly. A sharp pain in the abdomen that won't go away. A perforated bowel. A ruptured appendix. Internal bleeding. And within hours, you're in an emergency room, surrounded by doctors, being told that surgery needs to happen now. No delay, no second opinion, no time to prepare your body. And that's exactly why this situation is so dangerous, especially after the age of 75. Because an older body does not respond well to sudden, severe stress. It's not just one system being affected, it's everything, all at once. Let me explain what happens inside the body. When a major abdominal emergency occurs, the body triggers an intense inflammatory response. Your immune system activates rapidly, trying to control the damage. Your heart rate increases, your blood pressure fluctuates, your organs are pushed into overdrive. In a younger person, this response is often controlled and temporary, but in an older, more fragile body, it can spiral. This is where we begin to see something called systemic inflammatory response syndrome, SIRS. And when that happens, organs don't just struggle, they start to fail. The kidneys begin to shut down. The lungs can no longer exchange oxygen effectively. The liver loses its ability to regulate toxins. And once multiple organs are affected, the situation becomes life-threatening very quickly. This is why the mortality rates for emergency abdominal surgery in elderly patients are so high. In severe cases, we are talking about 30 to 50%. Think about that. Up to 1 in 2 patients may not survive. Not because the surgeons are unskilled, but because the body is overwhelmed beyond its limits. Now, I want you to understand something very important. You cannot always prevent an emergency, but you can reduce the chances of ever reaching that point, and you can prepare for it in a way most people never consider. There are two things that can make a profound difference. First, do not ignore abdominal symptoms, persistent pain, unusual bloating, changes in bowel habits. These are not minor inconveniences after 60. They are signals. And catching a problem early often means treating it before it becomes an emergency. That one decision seeking help sooner rather than later can be the difference between a controlled treatment and a life-threatening operation. Second, have the conversation now, not later, not in a hospital hallway at midnight, now. Talk to your family about your wishes. If emergency surgery becomes the only option, what matters most to you? Survival at any cost? Quality of life? Independence? These are not easy conversations, but they are incredibly important because in those critical moments, your family may have to make decisions for you. And the greatest gift you can give them is clarity. Not confusion, not guilt, clarity. Because when everything becomes urgent and overwhelming, knowing what you would have wanted can guide every decision that follows. So let's bring all of this together. We've talked about 5 types of surgeries that carry hidden risks after the age of 60. Open heart surgery, where the real challenge is not the operation, but the recovery that follows. Aggressive spinal surgery, where the promise of pain relief does not always match the long-term reality. Major cancer resections, where removing the disease does not always mean preserving the life you want to live. Elective joint replacement, where timing and preparation can matter just as much as the procedure itself. And emergency abdominal surgery, where the best protection is awareness before the crisis ever begins. Now, I want to be very clear about something. This is not a message about avoiding surgery. Surgery saves lives every single day. I've seen it. I've been part of it. And I am proud of it. But this is a message about something far more important: awareness. Because the most dangerous place a patient can be is uninformed. When you believe you have no choice. When you think a recommendation is a final decision. When you're rushed into something without understanding what it truly means for your body. Here's the truth I want you to remember. A surgical recommendation is not a verdict. It is the beginning of a conversation. You have the right to ask questions. You have the right to slow things down. You have the right to understand every option available to you. The surgeon holds the scalpel, but you hold the decision. And that decision made with clarity, with patience, and with the full picture in front of you is one of the most powerful tools in medicine. More powerful than any operation I have ever performed. Because after 60, your health is no longer about reacting. It's about choosing. Choosing what risks are worth taking. Choosing what outcomes matter most to you. Choosing how you want to live, not just how long. So before any major procedure, I want you to remember this simple principle. Small decisions, made with awareness, can completely change the outcome of your life. Now I want to hear from you. If you were sitting in front of a surgeon today, what is the one question you would ask before saying yes? Write it in the comments, because your question might help someone else realize they have a choice too. And if this video gave you even a moment of clarity, share it with someone you love, a parent, a partner, a friend over 60, because one conversation at the right time can change everything. Take care of yourself. Stay informed. Stay curious. And never stop advocating for your own health. You deserve clear answers. You deserve time to decide. And you deserve a medical team that treats you not as a case, but as a person. And one final thing. Everything I've shared today is based on clinical experience and medical research, but every individual is different. Before making any decision about surgery or treatment, please speak directly with your own doctor or specialist. They know your history. They understand your condition. And that conversation, honest, unhurried, and informed, is exactly where the best decisions are made.